Hello, I am Dr. Nawal. This is the Extended Talks course FCBS Part 2 by me, Dr. Nawal Mausam. I have recently been elected by College of Physician and Surgeon Pakistan for FCPS, and I've also ECFMG certified by United States Medical Licensing Exam. Today we are going to discuss about subfertility and how it is a very important topic. How to take a gynecological history in a patient of subfertility. Number one is introduction. You have to introduce yourself to the patient and ask the patient about education status of the patient, where the patient lives. Then confirm the presence of partner because you have to counsel the patient and the partner as well. Then the other question is whether they are living together with partner or not, and for how long. Fifth is coital frequency. Coital frequency and prior children, that is obstetric history of the patient. After that, you have to ask about the causes of the subfertility. In causes of subfertility, we have male subfertility or female subfertility. There are some questions that you can ask both of them easily, like past medical history of male and female, past surgical history of male and female both at the same time, medication list of both of them, allergies of both of them, if they have taken any previous treatment or previous cycles of treatment, or if they have both of them, they have done their previous tests or not. The most important thing to ask before going to the causes of the female subfertility is the report of semen analysis. Then you should ask about the socioeconomic history, affordability, because if we are going to tell them about the IVF cycles, we have to know the affordability of the patient. Smoking and drug history. Now coming at the causes of the female subfertility and causes of the male subfertility. First of all, you have to ask about the report of the semen analysis. This is a very important question to ask a couple who is suffering from subfertility and reassure them that almost 92% of the couples, they conceive within first year, and almost conceive 90 to 80, and other 10% conceive in the next second year. Causes of the female subfertility. Now, cause of the female subfertility is number one is tubal subfertility, pelvic inflammatory disease. Pelvic inflammatory disease is one of the causes that can cause tubal subfertility. Endometriosis is another cause, and adhesions is third cause. To ask about pelvic inflammatory disease, you have to ask about the foul smelling discharge, any previous sexually transmitting infections, dyspareunia, dysmenorrhea, dyschezia. To rule out the ovulatory causes, you have to ask in the history about hirsutism, irregular menses, and acne. That will tell us about the PCOS. Then you have to ask about the headache, double vision, to rule out the causes of the hypothalamic pituitary axis, and cold intolerance to rule out hypothyroidism. For ovarian causes, you have to ask about the history of hot flashes, chemotherapy, radiotherapy, family history of premature menopause. In uterine causes, we have MRKH, that is Mayer-Rokitansky syndrome. In this, there will be history of primary amenorrhea. In Asherman syndrome, there will be a history of multiple DNCs. And then if the patient at the semen analysis report is normal, there are no ovulatory causes, then the patient can be labeled as a cause of, and there's no other cause is found, then the patient can be labeled as a patient of unexplained subfertility. Coming at the male subfertility causes, there are history of secrotal surgeries. You should ask about history of previous infections, any ejaculatory problems that can happen if the patient is suffering from chronic diabetes mellitus. Erection problems can happen in cases of chronic neuropathies and stress related. So this is the history that you should ask in a couple who is suffering from subfertility. Thank you so much. You should subscribe to my channel, like the video, or any feedback, you can post it in the comment section. Thank you.